we're going to practice together thinking like a nurse. So we are going to pull up a case here in a second, but I want you guys to know for this first step, it's really important to kind of envision the scenario closely. I like to kind of keep a picture of the patient in my mind and update that picture as the case unfolds. I like to kind of read it at first before I ever look at the questions and figure out what's the priority problem. What should I kind of consider first? And then each time the case study updates, you want to revisit that mental picture, because even something as simple as moving from the ER to the ICU or the ICU to the step-down unit can affect how you would answer the item. So just kind of keep in mind this picture as we go. So we're going to read this together, and as we go, I'm going to highlight some pieces that stand out to me as being potentially really important, or things that flag in your mind as like, oh, this is important, I need to remember it later. Now, on the real NCLEX, you won't be able to highlight things like this, but you're going to have your dry erase board that you can just kind of make notes on. So it's the same thing, we're just going to highlight it so you guys can see what we're doing. So all right, we've got a 22-year-old in the emergency department. His mother calls 911 because she found him unresponsive at home, so that's not good. Then he comes to the ED, he's lethargic, confused, and he can't focus. He already has an IV when he comes in. He's nauseous with a fruity breath odor. So I think some of you already might know what this might be. If you have any ideas, you might drop it in the chat. And then we got his height and weight here. He's got sinus tach, lives alone. He's been quite sick over the last few days with nausea, and he's lost a lot of weight over the last few months. But she couldn't talk him into seeing the healthcare provider. And he recently had a bad bout of the flu a few months ago and hasn't bounced back. So he has a history of asthma and occasionally uses his steroid inhaler, but he doesn't have any other medical history. Okay, so remember, we're keeping a picture in our mind. So this is a 22-year-old. This is college senior. He was unresponsive, lethargic, confused, nauseous. His heart's beating fast. He's got this fruity breath odor, and I guess he's really skinny, and he's otherwise mostly healthy except for asthma. So keeping this picture in mind. Then when we actually do our physical exam, we confirm he's lethargic, he's tachycardic, at least his lungs sound clear, but we have these deep, rapid respirations, which it looks like a lot of you in the comments already recognize what that could mean. So you've already stepped ahead to our next step, which is analyzing cues. Well done. And then his skin is pale, cold, diaphoretic. We've got poor skin turgor, dry mucous membranes. So what could that mean? Those of you who knew it was DKA, in somebody with potentially DKA, what would poor skin turgor and dry mucous membranes mean? Let me know in the chat. And then we've got hypoactive bowel sounds, 1+ pulses. So remember, all these things, in addition to our mental picture from the note, we can also see that he's pale, cold, diaphoretic, and this poor turgor and dry mucous membranes. Doesn't look like anyone's commented yet to tell me what that might mean. Dehydration, Rick got it. Rick, you're cheating. You already passed your NCLEX. No, I'm just kidding. Thank you, Rick, for coming back. So we've got some signs of dehydration too, and then our vital signs we look at. Temperature is okay. We knew he was tachycardic, breathing fast. Blood pressure is low but not too low, and pulse ox is okay. So all right, we have this mental picture in our head. This college senior aged guy, dehydrated, sick, nauseous, lethargic, confused, breathing fast, and breath smells like fruit. All right, so from there, you want to think about what is most important, or all of these things, what requires the most immediate follow-up. NCLEX might specify how many things. Like in this item, we're being asked which four client findings would require immediate follow-up by the healthcare team. So keep in mind, we're always going to have a ton of things that are notable about our patient. We're going to have some pertinent positives, pertinent negatives, things that are missing that should be present, but not all of them are unexpected. And so you're going to have a lot of abnormal findings. Some of them are expected, some of them are unexpected. So we're looking for unexpected abnormals, and specifically abnormal findings that we could follow up on, that I could actually address and do something about. And so some things might be an unexpected abnormal, but not really anything I can address. So let's just take a look at these. And I haven't seen anybody has commented any guesses yet on these, so we'll just go through them one at a time. And whenever I've got which 4 or 3 or 2, or any time that the NCLEX specifies how many options you should choose, you're not going to lose points by picking one that's wrong. So for example, if I read this and I am certain of 3, you're not going to harm your score by guessing for the 4th, but you always want to shoot your shot and pick 4, okay? So let's read these one at a time, and I'm only going to pick those that I am certain are in the top 4, and then we'll see how many we wind up with at the end. So, okay, blood pressure. Now, the blood pressure is 106/68, and he's an adult, so this should be that normal blood pressure range, but it's not too low, right? Hypotension is technically a systolic under 90, so this is a borderline low blood pressure, but he's not hypotensive yet. Fruity breath odor, that's weird, right? Even if you don't know what that is or what it could mean, the fact that we've got this fruity odor, that's usually an indicator of some type of metabolic problem. But that is most likely what's causing an altered mental status in somebody this age, if it's not an obvious like drug overdose or anything like that. And so I'm going to hang on to that one as something that's definitely scary. Sinus tachycardia, pulse is 101. It's not a ventricular fibrillation or PVCs or anything that would be really scary. So I'm going to hang on to that one. It might be a problem, might not. Deep rapid breathing, yes. So that is also going to be connected to this fruity breath odor. We're seeing some type of potentially compensation by the respiratory system. And I'm seeing a lot of you guys are guessing 2, 4, 6, and 7. Melanie says 2, 4, 6, 7 for sure. So I like Melanie's confidence. Let's see. Weight and thin appearance. So that's an unexpected finding, right? This person has no reason to be so skinny, but it's also not something I could immediately follow up on. Even if I was super scared by this finding, there's nothing I can do right now to fix the fact that this patient lost weight over several months. This problem took several months to develop. I'm not going to fix it right now. Lethargic, confused, unable to focus. Yes, you guys know that neuro findings, that's pretty high up there in your ABCD. D is disability, is neuro findings. And a change in mental status can also represent a problem of breathing or circulation. If I'm not getting enough oxygen or blood flow to my brain, that can create these findings as well. So either way, I always want to prioritize abnormal neuro findings. And you guys said 7, many of you did. So poor skin, turgor, dry mucous membranes, yes. If you've got a patient with signs of dehydration, that is a circulation issue. That is an ABC issue. And we tend to kind of deprioritize skin assessment findings. So the NCLEX isn't going to give you something super obvious all the time, like low blood pressure and you can't feel their pulses. It's going to be a little bit more subtle. Like in this case, poor skin turgor, dry mucous membranes, those are clues for dehydration. So I wound up here with 4, fruity breath odor and deep rapid breathing, which we think is likely some compensation for a metabolic problem. And then this lethargy, confusion, inability to focus, which could be one of many high priority problems, plus some findings of dehydration. So well done, you guys. And I want to remind you that on the new NCLEX, you really do have to know your content, especially for the case studies. You could kind of lean into testing strategies more in the older NCLEX, but with the next gen format, you have to understand what you're looking at, understand the disease process to be able to figure out what's most important and answer the rest of these questions in the format. And so if you guys need some help with your content, I would really highly recommend you to go check out our new NCLEX cheat sheets that we've been working on for the last few months at Bootcamp for you. And Courtney is going to drop a comment in the chat box that's going to let you go download some of those for free if you don't already have a Bootcamp subscription. But that will help brush up your content as well as give you some really high yield tips and mnemonics and things for stuff that we know is going to show up on the NCLEX for you. So check that out if you haven't already played with those.